Our first session is an opportunity to meet some scientists and find out what they do, how science is applied to healthcare, and why they love their jobs. Hosting this session is Q-Som, doctoral researcher at School of Life Sciences at University of Westminster.
Thank you, Nick. So hello again and welcome to Science for You today. Just a reminder that there'll be an opportunity to ask questions at the end of each presentation. So please do use the chat and send those questions in as and when you have them. So first up, we're pleased to have Rebecca Macrae, who is a cardiac physiologist at Barts Heart Centre, who'll be teaching us about the human heart. Rebecca, over to you.
Hi, thanks very much. And so thanks very much everyone for having me. So as introduced, my name's Becky. I am from Barts Heart Centre in London, and I'm a cardiac physiologist, which is a bit of a mouthful. So I've been invited to speak about what we do in our job on a day-to-day basis, and the things that you can do within our career. So a little bit of background. So cardiology, what does that mean? So effectively it's the study of the human heart. So we're part of a big team that includes doctors, nurses, radiographers, healthcare assistants that help patients with heart conditions right from when they're a baby in mum's tummy right up to elderly age. So a few interesting facts for you here. So we know that the human heart beats on average around 70 times per minute. But of course, if you're a good athlete and you do lots of sport at school, then we expect that heart rate to be less. And we know that the heart actually beats around 100,000 times every day. That's 36 million times a year and 3 billion times in your lifetime. So while you're resting and sleeping at night, your heart is beating away, pumping and pushing blood around the body to feed your organs and keep you alive and healthy. So this is a interesting picture of a true human heart. So what we maybe not how we would expect to see it if we haven't done dissection yet at school, but we know if you make a fist shape, this is the size, roughly the size of your heart if it's healthy. So around the size of your fist, and it sits in your chest slightly to the left side. And I thought I'd put this in because I found this quite fascinating. This is actually a blue whale heart, which is ginormous. It's actually the size of a small car, and a human could actually fit in one of the arteries of a blue whale heart. Of course, we don't study blue whale hearts as cardiac physiologists, but they certainly are interesting to see. They're actually as heavy as a little elephant, and they beat so loud that they could be heard around 3 kilometers away. And rather than a human heart beating at 70 beats per minute, these actually beat 3 to 4 times per minute. So hugely different to a human heart. So going back to your biology, hopefully you've studied this a little bit of school. If you remember, we actually have 4 chambers within the heart. So you have the left atrium and the left ventricle, and they pump oxygenated blood to the aorta, so the biggest artery in your body, which takes oxygenated blood round to your body. And of course, it loses oxygen and comes back via the superior vena cava and the inferior vena cava to the right side of the heart, so the right atrium and the right ventricle, and that pumps blood to the lungs, so to the right lung and the left lung to get oxygen to become oxygenated. And we know we have 4 valves in the heart, so you can see these little almost like doors that regulate the blood flow going through. So you have the mitral valve, or you might call that the bicuspid valve, that's between the left atrium and the left ventricle, the aortic valve between the left ventricle and the aorta, the tricuspid valve, and then the pulmonary valve as well. So 4 chambers and 4 valves. And then you also have very important arteries that supply the muscle of the heart, that allow the muscle to contract. So they supply the muscle with oxygen. So these are called the coronary arteries that basically form around the outside of the heart. So what do we do as cardiac physiologists on a day-to-day basis? We're very fortunate that our job can be very varied, but essentially in a nutshell, we perform all the diagnostic testing of the heart within the NHS. So right from ECGs, which record the electrical activity of the heart, so that involves putting very simple stickers onto a patient's chest to observe how often their heart beats per minute and different patterns. We also perform exercise testing, so this this poor patient here looks like he's been turned into Darth Vader. So we're essentially looking at how his lungs and his heart react to exercise on a treadmill. We check pacemakers as well. So this is an example of just a diagrammatic example of a pacemaker that's in the left side of the chest with a wire that goes into the heart that stimulates the heart if it doesn't contract appropriately itself. We're part of a large team that performs keyhole surgery for patients with certain heart conditions. So if they have blocked arteries or if they have holes in the heart, if they need a heart valve replacement, that can be performed by keyhole surgery. So we form a team that's doctors, nurses, us and radiographers that perform these procedures. This is my specialism that I'll be talking about a bit more. This is ultrasound of the heart. So as you would see a baby scan where mum has a bit of jelly on her tummy to have a look at the baby, we can do exactly the same thing for the heart as well. And if we're really lucky, we get to help out with imaging for open heart surgery too. So what are the most common heart conditions that we see? So in adults, the most common acquired heart conditions, firstly, are abnormalities of the coronary arteries that supply the heart. So what can happen is if someone has a genetic predisposition, or if they don't exercise frequently, or drink or eat lots of sugary and fatty foods, and what we can see is a build-up of plaque or atherosclerosis within the arteries that supply the heart that causes a narrowing. So you can see here, compared to a nice clean artery, you can see a narrowing of the artery. And eventually what can happen is blood clots can form in this area and cause a heart attack for a patient. So how do we fix this? So really clever, through keyhole surgery, what we can do is pass a balloon into the artery and a stent, which is a wire mesh, and we can actually push out that abnormal plaque, and a wire mesh can sit in place to keep that artery nice and open. So that's a very common procedure that's performed. Another really common abnormality is calcification or sort of plaque deposits onto the aortic valve, so the main valve that guards the left ventricle to the aorta. So this is an example of a very healthy valve with 3 leaflets that opens very well, allows the blood to come out of the heart to the rest of the body. And this is a very unhealthy valve that's got lots of calcium on it, and it doesn't open properly, and patients can be very symptomatic with shortness of breath and dizziness from this. So we can fix this via open heart surgery, where we can replace the valve, and also in the last 10 years we've been able to do this through keyhole surgery as well, which is very exciting. So these are some examples of the types of pictures that we get through echo, so through the ultrasound scans of the heart. So this top image shows a very normal heart with 4 chambers, so left atrium, left ventricle, right atrium and right ventricle, and you can see a couple of the valves moving up and down in this view. So that's a very normal heart. And then these pictures show abnormal hearts. So if you compare this one to here, what we should see is muscle that divides the two from the right side of the heart to the left side of the heart. And actually, so the muscle is the white area here, but actually you can see a deficiency. So there's actually a big hole between the ventricles and a big hole between the atrium, which we should diagnose very early when a child is very young, to be able to repair that. And this is an example of a patient who has got a very, very underdeveloped small left side of the heart as well. So we call this a big mouthful, hyperplastic left heart syndrome. So you can see this chamber is very different size to this chamber here. It's very, very tiny. So this patient would need lots of operations to be able to fix that. And then this is an example of a patient with what we call an atrial septal defect, so a big deficiency, a big hole between the left atrium and the right atrium, which shouldn't be there. And this image shows a really nice 3-dimensional picture as well. The same thing, this sort of big black area here, that's the hole in the heart. So we can actually perform keyhole surgery again for these patients. This is a very special plug sort of thing that we put in through a vein in the leg that can go up into the heart, into the right atrium, and actually plug this hole very easily. So this patient, we can do this when they're awake, and they can go home the next day with their hole closed and everything all good. So what does it take to become a cardiac physiologist? So of course you need a minimum of 5 GCSEs, 9 to 4 or A-star to Cs. You need 3 A-levels, including a science subject, and 3-year healthcare science undergraduate degree. We do have students that come in through apprenticeship schemes as well. Rather than doing the degree, they can work their way up and do an equivalence process as well. So there's lots of options, and I've just got a few websites here that demonstrate, if you want a little bit more information, that gives you a little bit more information about our career. And if you're really lucky, as lots of us are, we also, maybe not at the moment because of the pandemic, but we do get to jet set as well. So these pictures are from a trip that we were very lucky to take to Kenya and South Africa back in 2019, where we saw lots and lots of children that are not as fortunate as us to be able to have healthcare access. So saw about 100 patients in a couple of days, diagnosing heart conditions and performing ultrasound scans and open heart surgeries, keyhole surgeries for patients that needed it, which is really, really exciting for us. And if you're even more lucky, then you might even get to do some ultrasound scans on pets as well. So we cross over it sometimes into the veterinary world as well. This dog looks like he's having a fantastic time. So that's it from me. Any questions at all?
Becky, that's fantastic, and thank you so much for sharing what you do, and just looking at the photos and the video was so fascinating, and kind of I've got a few questions, but want to open this opportunity for the floor. If anyone's got any question, perhaps whilst we're waiting for people to type in, I have a question for you, Becky.
Yeah.
What's your favourite aspect of your job? Because you've mentioned a couple of things, from performing diagnostic testing, looking at using the ECG, the keyhole surgery support, and so forth. But what is your favourite part of your job?
So my main specialism is echo, so the ultrasound scans, and I think what I probably find most rewarding, I did a job in a children's hospital for a few years, and the most rewarding part was actually seeing them diagnosing their heart condition very early, sort of first or second day after they were born, and then seeing them in 18 months and seeing their progress and seeing them in a couple of years, seeing them walk and seeing them grow and seeing them do really, really well. So I think that's the most rewarding part of my job, definitely.
Perfect. So I think we've got a few questions coming into the chat. So the first question is asked, have you ever felt unwell looking at the blood and organs?
Funnily enough, no, but sometimes I get to scan my own heart, and that makes me feel a little bit funny for some reason, but I can look at other people's hearts all day every day, and that doesn't give me a problem, but my own heart is slightly odd for some reason.
Great. Next question is from Brianna. Sasa, with open heart surgery, how do you keep the blood flowing around the body?
So with a very complicated and clever machine called a bypass machine, so the surgeons actually work to bring the blood out of the heart through special tubes that go through a very complicated machine outside of the heart, and that brings the blood to and from the body and does all the filtration that's needed to be performed, that the body would normally be doing if it wasn't having an operation.
Mm-hmm. And just 2 follow-up questions regarding open heart surgery. So first of all, how risky is open heart surgery?
Most of the time the risks are very, very low. It depends on the type of heart surgery. But for instance, for patients like we discussed before that have coronary artery disease, so a problem with the arteries that supply the heart, that's a very standard procedure that we do with a very, very low risk. That sort of operation is being performed every single day. So as long as the patient's relatively well, then the risks are very, very low.
And because of time, I'm going to perhaps take one more question, but I'm sure
Yeah.
you can answer the questions in the chat. So how about this one? What's the youngest person you have operated on?
Probably within the first couple of days, actually, after they're born. If they've got a very significant heart condition, then yeah, usually between 1 to 2 days after they're born. Tiny babies.
Well, thank you so much. Yeah, thank you so much, Becky, for your time. And please do keep the questions coming. I'm sure Becky can type in the answers in the chat for them as well. So thank you for that. So if we move on to the next speaker then,